Dialogues. I'm Mr. Zaman, and here's what I bring to you all from the world of medicine. Pitt study shows mint flavor vape juice to be more toxic for lungs. Adding mint flavor to e-cigarette liquids produces more vapor particles and is associated with worse lung function in those who smoke, report researchers from the University of Pittsburgh in respiratory research. Using a specially designed robotic system that mimics the mechanics of human breathing and vaping behavior, researchers showed that commercially available e-cigarette liquids containing menthol generate a greater number of toxic microparticles compared to menthol-free juice. An accompanying analysis of patient records from a cohort of e-cigarette smokers revealed that menthol vapors took shallower breaths and had poorer lung function compared to non-menthol smokers, regardless of age, gender, race, pack years of smoking, and the use of nicotine or cannabis-containing vaping products. Study finds parathyroidectomy not effective on kidney function in older adults with hyperparathyroidism. An emulated randomized trial performed using observational data from more than 43,000 adults with primary hyperparathyroidism found that parathyroidectomy had no estimated effect on long-term kidney function in older adults when compared to observation. However, early parathyroidectomy may preserve kidney function in patients younger than 60 years of age with primary hyperparathyroidism. Researchers from the Stanford University School of Medicine studied 43,697 adults diagnosed with primary hyperthyroidism to compare the incidence of a sustained decline in estimated glomerular filtration rate of at least 50% for those treated with parathyroidectomy versus non-operative management. The researchers found that the weighted cumulative incidence of a sustained estimated glomerular filtration rate or eGFR decline of at least 50% was 5.1% at 5 years, regardless of how primary hyperparathyroidism was managed. In the overall cohort, there was no difference in the adjusted rate of a sustained decline in eGFR among patients treated with parathyroidectomy versus non-operative management. However, subgroup analysis indicated that the patients younger than 60 years treated with early parathyroidectomy were more likely to preserve long-term kidney function. Novel primary care model proves effective for patients with severe mental illness. Over the past few years, the Department of Family Medicine and the Department of Psychiatry in UNC School of Medicine have been working together to spearhead the development of a new enhanced primary care model to provide better primary care for patients who have severe mental illness. A new analysis led by Alex K. Gertner, a psychiatry resident at UNC Hospitals, has added further evidence that the new model is effective. Gertner found that the enhanced primary care model resulted in lower hemoglobin A1C and blood pressure for patients with severe mental illness when compared to other primary care clinics throughout the state of Northern Carolina who do not use the model. Immunotherapy response in advanced melanoma influenced by prior treatments, says study. Research led by scientists at UCLA Johnson Comprehensive Cancer Center found that responses to a type of immunotherapy called PD-1 checkpoint blockade in patients with advanced melanoma dependent on whether or not they had previously received another immunotherapy, that is CTLA-4 blockade, as well as other factors. Their findings, based on analysis of 7 data sets generated over the past decade, which included results of tumor biopsies from more than 500 patients, are published in Cancer Cell. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.